This morning we're going to start with assessment of the female patient. And I want to tell you a little bit about who I am. For those of you who don't know me, I'm an osteopathic physician. I trained at Nova Southeastern University in Miami, Florida. And then I did my university residency training at Emory University in Atlanta, Georgia. I am a certified expert in functional medicine and anti-aging and regenerative medicine, age management medicine. I'm on the scientific board of advisors for our meetings, the age management medicine group, and also have lectured, trained, and consulted around the world. I've developed educational programs including womensrestorativehealth.com, sexualcpr.com, which are worldwide virtual education programs for clients. And also have right now going on our Sexy Younger Youth Telesummit with Robin Nielsen, where we interview 25 health experts from around the country and disseminate that information free to the general public. The biggest thing for us right now, for me and my goal and my mission, is to get the information out there to empower clients as much as possible, empower our patients, empower ourselves to heal and restore our own health. And I'm very, very passionate about this. So here's my email address to ask questions and to email those at drcabeca@cabecahealth.com. And I'll be checking those throughout the day. My disclosure is I am a shareholder in Zymogen. Now I want to show you this story, share my personal story with you, because many of us, as we step out of the box, certainly as I step out of the box of my training at Emory University to integrate functional medicine, age management medicine, focus on sexual health and hormonal therapies, I'm definitely stepping out of the box. Why do we do this? Because number one, to heal the patients, to do what I needed to do to see the patients getting better, but also my personal story. I've been as much as 80 pounds heavier than I am now, and at 39 years old, I was diagnosed with permanent irreversible infertility and PTSD. I was working 80 hours per week, the primary breadwinner, stressed out to the max, relationship issues, menopausal, infertile, depressed, absolutely zero sex drive. The picture at the bottom is not a picture I share because it improves my dating profile. No. It is because, honestly, why else would I share this but to empower you, to tell you clients like this come in every day and they feel hopeless. They feel absolutely hopeless. They feel there's no way for them to get better. How can they possibly look like us, the role models, right? And it's important to say, I've been there. And I'll tell you this story, that it's a constant process. I always say, life is like Candyland. Sometimes you've got ice cream cone, everything's great. Sometimes you're stuck in the mud. Sometimes you have to go back to start. I mean, it's a process. Just about 6 weeks ago, actually, the father of all 5 of my children, my ex-husband, he had a traumatic brain injury. And he was working on his buffalo ranch, and he fell onto his head, broke ribs, vertebrae, everything. He's been in the hospital since that time. And I'm thankful for the knowledge and information, the colleagues that I have, and everyone has intersected in my life for a reason, to be able to help him, empower him through this trying time. But also, within a week, my hair started falling out again in handfuls, 6 pounds heavier, acne, all that just resurfaced within 6 days' time of significant traumatic triggers. So I know what to do to exactly put a stop on that, because I remind myself I don't want to get back to this point again. And we don't have to. And it's not, like this is being told the hair loss and your thyroid's normal, I don't know what it is, right? Use Nioxol, something like that. All right. So as I work through the age management medicine principles, functional medicine principles, my restorative health principles, we work to restore my weight, restore my physiology, lose fat, and more important, restore the normal hormonal and ovarian function balance. Women who are told they have premature ovarian failure don't think this is possible. They become hopeless, helpless. It was devastating news for us. And so I introduce you to my little miracle, Ava, who is now 5.5 years old, as she strictly claims, and she's just amazing. The key thing is that when we follow our passions and our purpose, then we reduce stress. Shiva Kar, who we interviewed in our Sexy Younger Youth Telesummit, I encourage you to listen to this interview. She is amazing. I really want to get her here to speak. But Shiva Kar says, nothing reduces stress more and produces coherence then following your purpose and passion. Cabeca is of heart math. If you haven't done heart math, I really encourage it. Something that really helps us restore balance and get connected, because all of us here, we think out through our brain, out through our heads all the time. Getting reconnected into our body is a really big leader in stress reduction. So heart math, but reclaiming our passion. So it's really important, and I share that with you to inspire you and also to do for yourself. If something's not working for you, there's an underlying issue that still needs to be addressed, and that's what we do in functional medicine and age management also. So how do I work up a patient? Just like you do, same, go through an in-depth past medical history, social history, surgical history. Their OB history is really important to me as a gynecologist. How many miscarriages, how many abortions, what things have been dealt with and not dealt with. Their menstrual history, their pattern from the beginning of their menses. Also, their family history is really significant. Any childhood illnesses, were they chronically sick? Did they have recurrent ear infections? Did they have chronic constipation? Were they hospitalized for fever of unknown origin? All those aspects of history are so important because it's telling me what's going on to their first line defense, the immune system, the gut. And, what allergies currently are they suffering from? I also look at their environmental stressors. What in their environment could be stressing them out? Where do they live? In our area in Georgia, I have this beautiful client who had such IBD. She owns blueberries, the blueberry farms that y'all probably get your blueberries from. And they spray those farms tremendously. And we had to really work hard with her because her environment's not about to change anytime soon. Psychological stressors, really important also. PTSD for me, I know this inside and out. And we'll talk about that some more. Toxin exposures, what's in their diet, what's in their environment, what are they exposed to? And also nutritional habits. How are they eating? What are they eating? What's their concept? How do they look at what they're eating? Do they feel like everything they put in their mouth is going to make them fat? It will, right? So it's that sense of your nutritional habits and your thoughts about food. And also physical activity, movement. I like to say movement to clients versus exercise. Sometimes I feel like exercise, that's going to make me sweat. Movement, I can do fun and sweat and be great. So using terms that your clients resonate to. And for women, we like that. So also, I always ask, when do you feel like your symptoms began? And I look for something around that time that could be a trigger.